So let's talk about neurotherapy. And when we talk about it, first we have to consider healthcare. So healthcare really has four phases: prevention, treatment, rehabilitation, and palliation. Now, treatment is often going to be oriented in making a diagnosis. And once that diagnosis is made, particular treatments are started. And modern medicine excels in really labeling and treating conditions like a cancer or infection, but it struggles a bit with problems that are induced by lifestyle or life situations. Now, specific conditions can be treated specifically, but these lifestyle-related things can be treated so successfully that protocols don't really work. Meaning no two cases of migraine are the same, no two cases of back pain are the same. And some of these people with back pain may have anxiety, others may have hyperacidity, some may have constipation. So you can see no two cases are really the same. And when you look into how deep they are, that means the treatment has to change to accommodate for all of that. What often happens is then people are given a battery of different treatments to suppress all these symptoms. If the doctor is really good, they might talk about lifestyle modifications also. And then what the goal is to control particular biochemical parameters. But this kind of approach doesn't really work on the multifactorial stressors that are causing here. And often there'll be very personal factors you can't really remove from a person that are actually triggering a lot of these responses in the body. So when we think about people with migraines, one might be having migraines but fully functional, doing a job every day. Other person might be crippled and stuck in bed and can't do anything. Regardless, both people are suffering, and neurotherapy is a solution for both of these people. When we do neurotherapy, what we're modulating here and treating is the autonomic nervous system. You see, people respond differently based on who they are and what experiences they've had in life. So if they had very rough life experiences, they may not react at all to some stimuli. They might overreact. Right? But this fluctuation or variability between people is often based on the autonomic nervous system, and this can be treated, which means once it's treated, the symptoms are mitigated or made better. So this is one of the many forms of personalized healthcare, but it's really different in the way that the person's history of life, the way they've lived, what they've experienced, all of that really comes into a factor here as to how we're going to treat and where we inject when we treat the autonomic ganglia. So many times what we see here is people go through regular health care, they get some relief, the problem comes back again, and they have issues over and over again. What we see is people who don't receive an adequate response to their issues or feel like they've not been understood or heard, and they've gone through all the diagnostics and nothing is really making an answer for them. These people are often labeled as having a functional neurological disorder. So this is the most common condition in which neurotherapy is used. They can also be used for conditions like migraines, pelvic floor pain, unexplained chronic pain. It can be used for difficulty breathing, cough. It can be used for many different conditions, including hypertension, diabetes, and obesity. But really, what we're treating here is not that condition. We're treating the person who has the condition. And based on what they've experienced in life, they've adapted in a way that leads to these kind of stresses. These are maladaptions because the nervous system is overactive and it's manifesting in these ways. So when we treat them with neurotherapy, they often get a good relief because this is targeting them and what's important to them. So it can take time for a disease to emerge, and in that time making the diagnosis can be hard. Regardless, neurotherapy can help. Some people have diseases that are named, but once it's treated, they don't have the expected relief that's supposed to come with standard care. Neurotherapy can help here again. Other times the disease has been reared its horns and it won't back off. It's just going full force and a person is suffering. Again, neurotherapy can help here. And once all these symptoms are controlled, the reins of life are back in a person's hands.